Let's begin with the simple truth. We don't live in an analog world anymore. We shop online, we bank online, even we find love online if we're looking. But somehow our most treasured public institution, the NHS, still clings to paper records, fax machines, pagers, and queues. It's 2025, and in many NHS trusts, a child's temperature can be recorded with a pencil. That, quite simply, is no longer acceptable. Today, we confront a figure of £21 billion. That's the estimated cost of bringing the NHS and social care into the digital age over the next 5 years. And this sum, detailed in a new report commissioned by the Health Foundation and delivered by PA Consulting, is both staggering and necessary. It comes only days after Wes Streeting has promised money to help expand GP surgeries. But let's break this down. 8 billion in capital costs, the bricks and mortar of digitisation, electronic patient records, cloud systems, Wi-Fi, cybersecurity. 3 billion in a one-off transition cost, training staff, migrating data, integrating new systems, and more significantly, 2 billion per year in recurring costs to maintain, to upgrade, and to secure digital infrastructure that's been installed. That's another 10 billion over 5 years. This isn't a one-off tech binge, it's a transformation, and it's long overdue. The NHS is in critical condition, a phrase used not by its critics but by Lord Darcy in a damning review ordered by Wes Streeting. And we face waiting lists, record waiting lists, an exhausted workforce, a nation with declining health outcomes. And so the government's 3 big shifts, from hospitals to community care, from treatment to prevention, from analogue to digital, are not luxuries, they're essential. And without them, the NHS will die. Digitisation could, in theory, be a silver bullet, but for these problems, better scheduling, smarter triage, remote monitoring, and a single vision of truth for every patient across departments and wherever they happen to be. It could cut down on the 13.5 million staff hours lost annually to malfunctioning or outdating IT systems. Imagine that's the equivalent of 7,000 full-time staff doing nothing but battling digital chaos. But technology alone won't save us. As Dr. Malte Gerhold of the Health Foundation has put it, the government must fund the change, not just the tech. And this means human beings, staff who are trained, supported, and not left floundering in front of screens that they barely understand. We've been here before. In 2002, the National Programme for IT promised the world's largest civilian computer system, but by the time it was scrapped just over a decade later, it had burned through more than £10 billion. The lessons? Top-down implementation without staff buy-in is doomed. So is underfunding change management. Technology without culture change is very expensive paperweight. It's just rubbish. We've also seen the technology which is unrelated to the people who are using it in the Horizon software thing. If you don't trust the people who are using the technology, it doesn't work. If you think the technology is greater than the people who are pressing the buttons, it doesn't work. There's also a question of equity. If digitisation means care is only accessible to those who are digitally literate, or even those with reliable internet, it may widen, not narrow, health inequalities. Social care, too, must not be the poor cousin in this transition. So we need to confront the political reality. The money isn't really there. The £2 billion allocated in this year's budget is dwarfed by the projected need. Either other departments will face cuts, or taxes will have to rise, or more cynically, promises will quietly evaporate. Again, it comes down to Rachel Reeves not being in control. But delay isn't an option either. Each year of dithering increases the cost both fiscally and humanly. In the private sector, a 15-year lead in technology isn't just embarrassing, it's dangerous. Our healthcare system deserves better. So first, we need to ring-fence the funding. We need to stop raiding the tech budget to plug A&E deficits. Second, we need to focus on the human infrastructure, education, support, retention of staff during the transition. And thirdly, we need to be transparent about the failures and flexible about the implementation. Let local trusts adapt within a central framework. Get rid of the hangers-on. And finally, let's be honest. This transformation is not a political trophy, it's a moral imperative. If the government can fund missiles, it can fund Wi-Fi in a maternity ward. There was a harrowing article today in, I think, the Times or the Telegraph, about an MP, a former MP, who had the most dreadful birth experience, and had to have surgery without an anaesthetic and so on. And she's been left in terror. And I thoroughly understand this sort of experience. The problem is it only takes one bad experience to unnerve patients. And to digitise the NHS is not to save money, it's to save time. And in the business of healthcare, time is the currency of life itself. And anybody knows the absurdity of having repeat prescriptions and having to go cap in hand to your GP each time you need that prescription to be renewed is absurd. It's completely absurd. And if you happen to be somewhere else, it's a devil of a job getting that prescription. Devil of a job. And you simply don't know when it's going to come through. This sort of nonsense shouldn't be happening in the 21st century. We shouldn't be in this position. We should be able to know that when we walk into a hospital, our documents and our details, our healthcare is accessible in the same way as it should be when we walk into a GP surgery. Because we can't assume now that we have a GP, a family doctor who knows who we are. They have to look at the details on the screen. And those should be accurate and those should be accessible. So often they aren't.